All right, class, we're going to go over Unit 3 today. Here are our objectives is understand the geometry of film placement and the beam alignment using the paralleling and bisecting techniques. Understand proper vertical and horizontal angulation used on each arch and for the diagnostic images of bite wings and periapicals. And then also identify normal and abnormal structures on each of the films. So for bite wings, there is horizontal and vertical bite wings. The ones in the picture down here are an example of the 4 bite wing films that you will take, and this is with the horizontal films. This shows maxillary and mandibular teeth in occlusion, and only the crowns of the teeth are seen. It can only be taken if there's opposing teeth in the opposite arch for it to hold the film. So if the patient doesn't have their maxillary molars, it's going to be hard for them to hold the film, so you'll only take it if they have opposing teeth on the opposite arch. For periapical, this shows the entire crown and root structure from the occlusal surface or incisal edge to the root apex, and usually 2 to 3 millimeters of bone structure past the apex of the root. So for example, this one here is a maxillary periapical of the molars. And then this one's a mandibular periapical of the premolars, and then this one also has the first molar in it as well. So 4 areas to consider when exposing film are with sensors is the sensor placement, vertical angle, horizontal angle, and the covering the sensor with the PID. And then some technique errors that you'll run into are placement, foreshortening, elongation, cone cutting, and underexposure or overexposure, which we'll go through next. Sensor placements are the structures being radiographed. So if you are doing a molar image, you want to have a 1/2 inch behind the last erupted tooth, the third molar if present, the second molar, and the distal of the first molar. And then with bite wings, they will need to be seen the maxillary tuberosity and retromolar pad behind the last erupted molar. And then for your premolar bite wings and periapicals, the distal of the canine, premolars, and the first molar will need to be in that film. For your canine periapical, canine and lateral incisor, which we also known as the bride and the groom, are in the center of the film. And then with anterior periapicals, it is going to be the central incisors in the middle of the film, and then usually the lateral incisors on both sides. So with improper film placement, as with paralleling technique, improper film placement is one of the most common errors seen in the bisecting angle technique. And in the molar film below, the film was placed too far forward, cutting off the distal root of the second molar and failing to image the third molar region. So to fix this, we would actually have to move the sensor further back in the patient's mouth to get all of the structures we need in this image. So that's improper film placement, and that can happen anywhere in the mouth. You just got to make sure your film is over the teeth that you're trying to radiograph. Here's an example of vertical angle. So for maxillary teeth, you'll have positive vertical angle, and mandibular teeth, you have negative vertical angle. So shown in these pictures here is that if you are radiographing the maxillary arch in the molar area, you will line up the PID to have a positive vertical angle looking down on the teeth in order to get both the root and the incisal edge of the tooth. And then for mandibular arch, you are going to use a negative vertical angle, angling the PID down towards the patient's mouth in order to get the root structures and incisal edges on the bottom. And then this is going to be a 0 vertical angle, and that is holding the PID directly parallel with the floor, directly right at the patient's arch. So in that case, we would get our bite wings holding at a 0 vertical angle. So if you have excessive vertical angle, you will have what is called foreshortening, and then if you have too much, the image will be foreshortened or reduced in length, and the angle of the x-ray beam forms with the bisecting angle is greater than 90 degrees. The red lines in the film represent the actual length of the tooth of number 9, and the black arrow points the end of the image of the tooth. So the tooth itself should actually be this long, but because we had too much vertical angle looking down at that teeth, the teeth actually look shorter than they should be. So that's what we call foreshortening. So when we're doing vertical angle of the maxillary arch, if you do too much, the teeth will actually look too short. And then also if you have insufficient vertical angle or too little, you'll have what is called elongation of the teeth. So if you're holding the tube head too far below a vertical angle that is needed, the teeth will look very long. So for this one, the tooth structure is only supposed to be this long here, but it's actually almost the length of this whole picture. And it looks like the tooth has a very long root. So you just gotta watch out of how we're using our vertical angle for each of the films. Usually it's +10 when you're using a maxillary picture, or -10 if you're in a mandibular. So a +10 or -10. Now we're gonna go into techniques. There's bisecting technique and paralleling technique. Bisecting technique is where the film is placed as close to the tooth as possible, and then vertical angle of the tube head is directed so that the central ray is perpendicular to the imaginary line that bisects the angle formed by the long axis of the tooth and the plane of the dental film. So in this picture, for example, here's the long axis of the tooth. Here would be our X-ray film, and this is kind of our imaginary line, which is our bisecting angle, which is in line with the in between those two. And then you're going to center your X-ray head right at that line and get your bisecting technique, and that will get the entire tooth in the image without any distortion. For paralleling technique, this is when the film is placed in the mouth so that the long axis of the film is parallel with the long axis of the teeth being radiographed. And a paralleling instrument with an aiming ring is normally used to orient the film. Teeth and ring are in a parallel relationship, and when the X-ray beam is aligned with the ring, the X-ray beam will be perpendicular or right angle to the teeth in the film. So for this one, there is no imaginary line. The film is placed, the long axis of the tooth sits right alongside that, and your X-ray beam is going to shoot through both of those, with those being both parallel to the X-ray beam. And for paralleling technique, is very common to use this in people who don't have a problem with fitting their X-ray sensors into their mouth. But with the bisecting technique is easier when they have a smaller mouth and there needs to be more angle of the sensor in their mouth because of a low palate or something like that. So then we also have our horizontal angle, and that is important for achieving space between the contacts. Diagnostic for detecting caries, calculus, and other interproximal abnormalities. To do this, you align the tube head to the curvature of the patient's face or arch to shoot through the contact points. So for example, if you're going to take a picture of the maxillary arch and you're going to put it right back here, you're going to want to move the PID head, the tube head, into the patient's face to kind of get their curvature of their face. Because their teeth kind of come at a curve. So for example, this picture is showing that an incorrect vertical or horizontal angle, would be going too far forward like this, and then you would not receive the contact points between the teeth. And then correctly, you would have it directly at those contact points, shooting right between the contacts. For me, the easiest way to achieve this is having them almost smile while they put the sensor in their mouth to see where their teeth are, and then kind of aligning it up with the teeth to shoot between the contacts. So if this is not achieved, the horizontal angle, you will also have what we call overlap as the error. Overlap is the superimposition of part of one teeth with part of the adjacent tooth. So for example, this picture shows that if you're shooting from this area, you're going to have overlap of these two teeth, but if you were directly in between the contacts, you would see space. So this picture shows overlapping of these premolars and first molar in this film. So the X-ray beam should be perpendicular to the dotted line below, and in order for there to be open space there for things like detecting caries and calculus, like I said, which are super, super important on your bite wing radiographs. So here's another error that can come about, which is incorrect exposure factors. The standard exposure settings on your x-ray machine will be used, especially in our clinic here. However, if you're taking radiographs on a child, you may need to decrease the settings because they're much smaller, and if your patient is very large, maybe you increase the settings for the density to go through those tissues. Underexposed results with the exposure factors are set too low for the patient size, and overexposure results when the exposure factors are set too high. So underexposure will show up as a very white film, and overexposure will show up as a very dark film. And then the correct exposure will have the variations of gray, black, and white in there so that you can see all of that in the image. We don't want it to be too light or too dark because then it's not easy to diagnose. So in review, we're gonna ask you a couple questions here to some of the classmates to see what you guys can detect by looking at some errors. So I'm gonna call on some classmates to answer a few questions before we're done here today. So this one is a picture right here on the left, and we're asking what radiographic error is shown in this image. Billy, can you tell me what this is showing in here?
Horizontal angle.
That is right. So because the horizontal angle is not lining up with the teeth and their contact points, we are seeing some overlapping of the teeth's contacts where we won't get the diagnostic image to detect calculus and caries and things like that. And this is a bite wing film. And like I said, it's extremely important to have your contacts shown in bite wings because those are the ones that are taken yearly to diagnose caries. All right, and then this one is a picture of a woman getting her x-ray taken. And what film is being taken in this photo? Zach.
Maxillary canine periapical.
That is a maxillary canine periapical. So, as you can see, we are putting the sensor in on the maxillary arch of this patient here. And then it is not central to her incisors here, so it is off to the patient's left. So we are going to get a picture of the canine, and then it is going to be a periapical film because we don't take bite wings of central or anterior teeth. And then last question, so this hygienist is taking a picture of this woman's teeth here, and what type of vertical angle is being shown in this image? Thomas.
Positive vertical angle.
It is positive vertical angle. That's very good. So we are showing here that we're taking a periapical, and she is using positive vertical angle by having the PID above the patient's face in line with the film sensor. So if she was using not enough vertical angle, it would be down like this. We would get elongation of the tooth. And then if we were too high, we would get foreshortening of the tooth. But she's using positive vertical angle in order to get the diagnostic photo of a periapical. All right, class, continue to study up on your chapters and reviewing the PowerPoints that we've gone through the last few days, and we will have a test on Unit 3 next week.